Okay, hello everyone, my name is Babeta, I'm from the Czech Republic and I work in Tomáš Baťa Regional Hospital in Zlín. And today I would like to tell you a little bit about our case report named Can Zucchini Kill You? So imagine, it's the beginning of September, warm, beautiful night, and you're sitting in the emergency department. What a dream, right? And a few minutes before midnight, here comes our patient. Our patient is a 54-year-old woman who's treated for epilepsy. And she complains about abrupt, severe abdominal pain accompanied by vomiting and pink, watery, bloody diarrhea. This patient is exhausted, dehydrated, she has low blood pressure, prolonged capillary refill, and tenderness in the right mesogastrium. Laboratory results revealed quite significant elevation of liver enzymes and leukocytosis. We also performed abdominal X-ray with no signs of ileus or pneumoperitoneum. So, we are thinking about gastrointestinal bleeding because of the pink, watery, bloody diarrhea, or maybe intra-abdominal ischemia, such as hepatic vessel obstruction. So, we also performed a CT scan. Intra-abdominal ischemia and gastrointestinal bleeding were excluded. However, the additional findings made our differential diagnosis pretty challenging and difficult. So let me show you. Number 1, periportal coughing. Also, swelling in the gallbladder bed and intra-abdominal fat. Number 2, thickening of the colon wall. And number 3, gastroctasia. So this patient, dehydrated, low blood pressure, vomiting, diarrhea, liver enzymes high leukocytosis, and CT scan. She was admitted to the intensive care unit. The admitting physician thought that it could be some kind of infectious disease. So she was treated with antibiotics, specifically piperacillin tazobactam and vancomycin per os. By the morning, her blood pressure normalized. However, the intense abdominal pain persisted. We are thinking, what can cause such symptoms? Because we are thinking of the infectious diseases, we took a stool sample, which was negative. We also tested this patient for acute viral hepatitis, also negative. So, what is the problem? We decided to go back to the beginning and recollect carefully the history. Symptoms started abruptly. She did not take any special medication beside her chronic medication for epilepsy. She was not ill, nor take any antibiotics. Nobody in her family had similar problems or any kind of health problems. And her last meal was baked zucchini with bread. You hear it, right? Baked zucchini. So, while the physicians were discussing the cause and they were kind of puzzled by the combination of clinical course, CT scan, and laboratory results, the nearby standing nurse wondered if these problems could be related to the baked zucchini. As she spent more time with the patient told her that the zucchini tasted kinda weirdly bitter, but she didn't pay any special attention to it and didn't tell to the doctors. And also, she ate the whole portion of the baked zucchini, even though it tasted kind of weird. So, the nurse knew that you should not consume bitter zucchini, but she didn't know why. And I wonder, do you know why? Because now we all know why. The bitterness in the zucchini is caused by substances called cucurbitacins. These are highly oxygenated tetracyclic triterpenes, and don't worry, I don't understand this spell either. But what's important, they are produced in response to environmental stress, such as poor growing conditions. You can find them in vegetables from the cucurbita group. Besides zucchini, it's also cucumber or squash. You can know toxic squash syndrome. So, according to the study in France, of course you can get intoxicated by cucurbitacin in some higher concentration, and according to the study in France, over 95% of intoxications are mild, and the usual symptoms are nausea, vomiting, dehydration, and diarrhea with hypertension. So it's the clinical course of our patient. The diagnosis is by clinical presentation and careful history. And there is no specific antidote, so the treatment is symptomatic. So, do we have a happy ending? We contacted the Czech Toxicological Information Center in Prague, who confirmed our suspicion of cucurbitacin poisoning. Our patient was practically symptom-free on the third day onward, and her aminotransferases normalized within 5 days. And on day 6, she was discharged from the hospital. However, we wanted to confirm the cucurbitacin poisoning in samples of blood and urine with cooperation with the Czech Toxicological Center. However, these samples were accidentally thrown out by our cleaning staff. So yeah, mistakes happen. And that is all from me, and I thank you very much for your attention.
All zucchini parts are removed from the lunch today. As of now, we cannot.
That is take-home message. Don't eat with zucchini.
I was thinking how large zucchini you will present to us, but it was ingestion. We have our pharmacologist and toxicologist, Dr. Dan Perry, and
Thank you. That was a very interesting presentation. I'm a sucker for a great title, and that is one of the best titles. If this was a trauma conference, you'd be showing something very different. I have a question first, and it's more about the history. Did you ask the patient or get around to sort of where she sourced the zucchini, or if there's something unique about how she came about to get it?
Yeah, that's what I think, and I'm really happy that you asked, because she got the zucchini from her mother-in-law.
I wasn't thinking anything nefarious, but maybe there was. The reason why I ask that is obviously a lot of times it's unexpected, sort of wild sort of versions of the cluster of vegetables and fruits. Melon can also do this. And so it's one of the warnings. When you were reading the case, there's a great case series. France has a lot of this. Did you come across the case from a few years ago, maybe 2 or 3 years ago, maybe longer, I can't remember now, where there was a couple of severe ingestions and the women went on to lose their hair? And if you happen to come across it, do you know why or how or anything more about?
I don't remember reading this case. I'm not.
No worries. Sure. The reason why I bring that up is there may be more to this story as this evolves. So. This cluster of compounds, there's about 20 known versions of these, named with sort of letters because people lack creativity sometimes. But version B has actually got this sort of emergence in the literature these days, looking at anti-inflammatory, antibacterial, and anti-cancer reasons. And so these women who lost their hair may very well be the impacts on follicles and sort of high turnover cells. And so this is important, even though this is rare for most of us, and I've only seen one of these cases when I used to do toxicology call. But I think now that this cluster of chemicals might turn into drugs for cancer, we should know about this. So it's a great presentation, and happy to hear the story, and it was a great title to it.
Thank you.
Any questions? We have few there. Let me use the prerogative of having the microphone. The one I work in critical care, and the one thing which struck me when she came was this huge stomach.
Oh yeah.
And the point is, I've seen number of people who died because of such a big stomach, which we didn't evacuate. So I hope she got a NG tube and emptied it before she vomited, aspirated, and died. Go ahead.
So I have a rapid question. Do you know of any other sources other than zucchini where you can have this kind of intoxication?
Oh yeah, there is known. There's toxic squash syndrome, and there are cases of the squash juice. People are drinking it for better health benefits, and you can get intoxicated by these juices from the squash if there are enough cucurbitacins.
Thank you very much. It was brilliant.
Thank you.
You know, you identified what Osler told us. If you want to know what's wrong with a patient, talk to the patient and ask the patient. And that's what exactly the patient told what's wrong with her. The other thing is, how well known is the fact that zucchini, particularly the bitter zucchini, can cause problem? I mean, is it a well-known fact? Like, I love zucchini. I didn't know that.
So I did not know about it. I knew about the bitter cucumbers. However, this case was in our media, and as I was reading the discussion, many people were like, how did they not know it was zucchini? Because everybody knows zucchini, bitter zucchini, you should not eat bitter zucchini. But we actually did not know. And the patient did not tell her that it was bitter. She told it to the nurse. So we had no clue that bitter zucchini could.
This lecture was supported by producers of cucumbers.
Thank you very much for this very interesting presentation. And now